Speed on board. Healthcare onboarding accelerated. So the last video in this series, the last vector, is interoperability. Let's take a look at how interoperability works in the emergency department. So the emergency department's most critical interoperability feature or requirement is to get the orders out to lab, radiology, cardiology, respiratory, any of the places that need orders, and then to get those test results back. You're trying to speed up diagnostic testing so that you can make a decision to admit or release, and the orders and results are the most critical thing that needs to flow between systems for the emergency department to operate smoothly. The second area would be bridge orders. If the ED physician decides that the patient meets admission criteria, they enter a series of admission orders, they're bridge orders, until the doctor that's going to be the attending can get in and do a full workup on the patient. So those admitting bridge orders are sent from the ED system out into the main EMR, and things start happening based on that. So that's a second area of interoperability. Third, and equally important, is getting a transition of care record back to the primary care doctor. So if you go to the emergency department and you're released, we want to notify your primary care doctor that you were there so they can follow up with you within 72 hours. And so they can actually change medications or make sure that things, treatment that's not going well, whatever needs to be done, that the primary care doctor can keep you out of the emergency department. With the new value-based payment models, part of the goal is to reduce the overall spend, healthcare spend for a patient. And one of the expensive things that could be controlled is the emergency department. So keeping patients out of the emergency department also means knowing that they were there and having them come in and reset prescriptions or treatment protocols. So the third and important one would be transitions of care. So again, in review, orders and results, bridge orders out once you're being admitted, and then the transition of care record back to your primary care provider. So those are the things that are important. Oh, wait, let's back up and take a look at this. What's wrong with that picture? Did you notice it right at the start? It's the pen. That doctor's actually writing orders. So please, no writing orders with a pen. Anyway, we thank you for watching. Hope you caught that when you first saw that. Wanted to make sure we talked about it. And this concludes the 5 vectors for the emergency department.